and I want to wish you all a happy... Hey friends, welcome back to the channel and another video. My name is Dr. Caroline, a practicing board-certified family medicine physician. I want to wish you all a happy 2026. I hope the year has started really well for you. And for my first video of 2026, I wanted to talk about some of the reasons why you may still be struggling as an RVU-based primary care doctor. I want to go through some of those reasons today and also how to remedy them. Outside of models like DPC, concierge, etc., I think most healthcare systems are on a productivity model, meaning that most physicians' compensation comprises of a base salary and some level of productivity bonus, or it could all be productivity based. So I myself do practice in a productivity model. So there is a base salary and then there's productivity bonuses on top of that based off of how well you do or how productive you are as a physician. If you are a new primary care physician, meaning that you're right out of residency and don't quite understand this whole productivity stuff, I have several videos dating back probably a year or two ago talking about sort of some of those definitions and what productivity actually means. So if you are a new attending primary care physician and you just want to get a good understanding of some of those definitions, I would definitely check out some of my older videos. And then you can always come back and check out this video to sort of build on your knowledge. So in this productivity model, we do find that physicians are a lot busier. They're seeing a ton of patients, they're overworking, and at the end of the day, they still feel like they're not compensated adequately, or at least to the degree that they feel they deserve. Physicians are not able to see the true fruits of their labor in financial sense. We're not trying to get deep here, but physicians are not seeing the true fruits of their labor in terms of they're not seeing that financial gain or that compensation that they feel they deserve based off of how hard they're working or how many patients they're seeing, etc. And I'd like to believe that a big part of this may be due to a disconnect, meaning that physicians either don't really understand what productivity entails, or if they do, they don't truly know how to put it into practice. They don't take full advantage of all of the opportunities available to maximize productivity. And that is essentially what I talk about in my YouTube videos and also what I teach in our productivity program. I help primary care physicians maximize productivity and scale their income without overworking, being overwhelmed, or risk falling into burnout. Your well-being and your health should not take a backseat. As important as it is for us physicians to do our absolute best to take care of our patients, it doesn't mean that our health and our well-being doesn't matter. And it also doesn't mean that we shouldn't be well compensated for the hard work that we do. So if you are interested in joining our productivity program, definitely check out the link below in the description box to our website where you can apply. But again, for this video today, I want to highlight some of the reasons why you may still be struggling as an RVU-based primary care doctor. And the first reason is that you may not have actually realized that you're struggling. Because the thing with struggle is that it can sometimes be really subtle, right? You might be a little bit more irritable, you might be a little bit more impatient with your staff, you might feel like you're moving slower in your day-to-day work, or you might feel weighed down, etc. All because of what's going on around you, right? You've got 20 plus or 30 plus appointments that you have to see, and the associated charts that you have to close, all of the admin tasks that you have to complete, and you're also probably thinking about all of the things that you have to do when you leave clinic, but might not actually even get to do them because you're probably taking work home and that ends up taking priority. So if you have not realized that you're struggling, it's hard to then see that there's something to be fixed. And I've talked about my struggles many times in my YouTube videos. This is something that I saw in myself several years ago when I was going through burnout. I was seeing about 30 patients a day. I was working hard, as I should. But there was a time I remember I was definitely more irritable. I was definitely more impatient with my staff. I was definitely way more stressed than I'd ever been before. And I thought to myself at that time that I'm just stressed. It's part of the job. It's what comes with the job. So I kind of just chucked it out the window. But for me, these were the initial stages of my burnout. And I didn't realize it until 6 months later when I was in full-blown burnout that is what was going on. And during all of this, as you can imagine, my productivity fell. My income obviously followed suit. And so whilst I'm going through all of this burnout, the cherry on top is that I was also losing money. And I could not understand why at the time. Like I said, I was seeing about 30 patients a day. I was working hard. I was doing all the things I'm meant to be doing. Nothing had changed. Nothing had changed. But obviously looking back, because hindsight's 2020, because I was going through burnout, I was probably not as efficient as I previously was. And I was probably not as attentive to all of the things I needed to be doing to actually maximize productivity, to actually stay on top of my productivity game, which is why everything was trending down. And so your story doesn't need to sound like mine. You don't need to be on the brink of burnout to realize that you're struggling or to realize something is off and that something does need to be changed. Like I said, some of the signs of struggling may be very subtle and you might not even be paying that much attention to them. But I definitely invite you to start looking into yourself, looking into how you're feeling when you're at work and all of the things that are going on to know whether or not are you thriving or do things need to be addressed. Your health and well-being matters just as much as your patients. And of course, your financial wellness matters as well. And so that was the first reason, is that you might not have actually realized that you're struggling. Moving on to the second reason is that you're keeping an excessively busy schedule. And so you might be thinking, but I thought that's the whole point, is that I have to keep busy. I have to see a lot of patients in order to be productive and earn a lot of money. While yes, some of that is true. You do have to see enough patients in order to bill for enough services. for that down the line to turn into revenue. Again, I talk about this so much in my videos, is that volume is not the only answer. There are several other strategies that you have to really pinpoint down in order to maximize productivity without just solely focusing on volume. And this is what I was mentioning earlier, in that you might not be as attentive to some of the things that you need to be doing that affect productivity. And so if you're not doing those, then obviously your productivity suffers. And so you feel that you have to see so many patients in order to sort of stay on top of the game. And so to me, if you're still seeing an intense number of patients, it must be because you want to do that, because it is no longer necessary to see 30 plus patients a day to make a really good income in primary care, if that is the reason you're seeing that many patients. Like I said, if you just enjoy seeing that many patients, then that's fine. But if you're solely doing that for the sake of earning more money, then you're eventually going to tire out, if you haven't already. You really have to start working smart in productivity in order to scale your income without burning out. Because remember, as primary care doctors, our job is not just about seeing patients. There's 1,000,001 admin tasks looming over us every single day. They never seem to end. There's always something that needs to be done. And you have to make time for these things as well. The first module in our productivity program is how to create your ideal schedule and your ideal workflow. So from establishing your ideal patient volume, how you're seeing those patients, how you're managing admin tasks, all of those things matter when it comes to workflow, productivity, and scaling income without putting yourself at risk for burnout. It is about time that we start to merge quality and quantity. As I've mentioned, yes, volume is important. You do have to see enough patients, but it doesn't mean that you need to see heaps amount of patients in order to be productive or earn a really good income. And remember, you still want to make sure that you're actually providing quality care to those patients that you're seeing. So if you're seeing 40, 50, 60 patients a day, what does the quality of the care that you're providing actually look like? Now, again, I've never seen that many patients before, so I don't know. There might be some of you out there that are actually seeing that many patients, and maybe you're doing a really great job at merging, quality and quantity. But it's really difficult for me to see that, especially when we're hearing from patients that they feel rushed. They feel like we're not giving them enough time, etc. It's not one or the other. It's not quality or quantity. It's not, well, I'm going to provide great care to my patients and allow myself to suffer, nor vice versa. It's not that I'm going to make sure that I see a lot of patients and make a lot of money and allow my patients' care to suffer. We have to be able to merge the two so that our patients are well taken care of, but that we as physicians are as well. Physically, mentally, emotionally, financially, etc. So there you have it. That was reason number 2. You're keeping an excessively busy schedule, and we need to change that. This takes us nicely to the third reason, which is your workflow is not ideal. As I've mentioned, if you have a poor workflow, you're very likely putting yourself at risk for burnout. How you approach your workday matters in how successful you are as a doctor, and not just financially, but mentally, physically, etc. If you leave work each day and feel like you've been run over by a bus, you're doing something wrong. Having a systematic approach definitely helps. It doesn't mean that you need to be a robot, but you should know your to-dos each day when you walk into work. If you go into work and your approach is, we'll see what the day brings, you're very likely all over the place and unorganized. And this kind of approach will very likely affect your productivity, your physical and mental health. And eventually this will negatively affect how you view your work, because you'll very likely be stressed all the time. Now, of course, we won't always know exactly what our day will look like, because something can happen that kind of throws us off a bit, but we should be able to get back on track if we know our systems well. So when it comes to establishing an ideal workflow, build your ideal schedule, have a systematic approach to your workday, learn how to tackle your admin tasks appropriately, be firm when you want to leave the clinic, and so forth. In our productivity model, our method is designed to help you maximize productivity and your earning potential in the most effective and efficient way possible, whilst keeping your workload manageable and keeping you from burning out. So each module is designed to help you create and add on to that ideal workflow. Like I said, in the first module of the program, we talk about creating that ideal template, that ideal schedule. And then in the subsequent modules, we tackle different areas like managing admin tasks, billing and coding, etc. We also touch on topics that you may not even have thought about. So how to track your own RVUs just in case you don't receive reports from your employer every month on your productivity and your projected income. We help you on how to track your own RVUs. We also talk about things like how to manage your RVUs in the setting of time away. So if you plan to go on holiday for a week or two, you don't want to come back and find out that your RVUs for that month have significantly dropped to where it now affects your overall average and what your projected income will actually look like. So these are some of the things that, again, you may not have thought about and probably no one has told you about, but these are the things that we touch on in the program as well. Again, you can check out our website using the link down below in the description box, where you can also apply to work with us. So that was reason number 3, in that your workflow is not ideal, and I'd love to help you create a much better one. This takes us nicely into the 4th and final reason as to why you may still be struggling as an RVU-based primary care doctor, and that is missing out on billable services. Now, just to be completely clear from the beginning, I am not saying performing services just for the sake of billing, because then it's just a headache and you're kind of stepping away from the core reason of being a doctor and doing what's right. What I mean is failing to bill for services that you have actually performed, meaning that you've performed a service that you deemed necessary for that patient, but for some reason you failed to bill for it. You failed to capture those codes because maybe you didn't realize that it's a billable service, or you may have not completed all of the documentation necessary to actually receive credit. And so again, if you're practicing in a productivity model, having several occurrences like this, missing out on billable services like this, will negatively affect your revenue over time. And a bit of a side note here, some providers get excessively upset about this whole billing thing, and I can never understand why. They say medicine is all about billing and all about money, etc. Well, do remember, at the end of the day, medicine is a business. Whether you want to believe that or not, medicine is a business, and these healthcare systems have to do what they have to do. But for you as the physician, if you are completing the necessary services for your patients, screening them, obtaining appropriate evaluations, starting them on appropriate treatment, etc., why is it so bad to bill for that when that's what we're supposed to be doing? It is your job as a physician to ensure that the necessary and appropriate services are being provided to your patients. And that is not just a money grab on your part. And so if you are in fact doing all of the right things, why would you not bill for that? That's all I'm saying. So back to the topic, there are basic things that we do day in and day out. Dietary counseling, exercise counseling, smoking cessation counseling, alcohol misuse counseling, all of that stuff we do probably every single day, multiple times a day. But there's several other services that you may be completing or may be providing to your patients that you didn't know are actually billable services. So you have to be attentive to all of the services that you typically perform and ensure that you're actually bidding for them. You're capturing those codes. Do not undervalue your work and do not undervalue yourself. If you're putting in the work, you should be appropriately compensated for it. Billing and coding is the largest section in our program, and rightly so, because the last thing any of us need is putting in so much work in taking great care of our patients and then not being appropriately compensated for it. Now, I shouldn't have to say this, but obviously none of us went into this profession just for the money. But that doesn't mean that we shouldn't care about it, and that certainly doesn't mean that we should undervalue our work or ourselves. The last note here, and this is something that I touch on also in the program, is that don't bring emotions into billing and coding. Just stick to the facts. If you don't know what that means, then we can discuss it on our scheduled call. Again, the link to our website is going to be down below in the description box, where you can also apply to work with us. All right, friends, thank you so much for joining me in this video today. And again, happy 2026. I hope the year has started well for you, and I hope that it continues to be well for you. If this video was interesting to you and you'd like to see more content like this, definitely consider subscribing, because I do post monthly now, doing my best to help you maximize productivity and earn a higher income as a primary care doctor. Make sure to leave a like and share this video with your colleagues. I'll see you on the next one. Bye.